Hi, my name is Thomas, and I'm going to be talking about panic disorder and the prevalence between men and women.
Hi, my name is Isa, and I'm going to be talking about stress and anxiety in college students.
My name is Ryan, and I'm going to be talking about the importance of attachment theory following domestic abuse-related PTSD.
And I'm Lexi, and I'm going to be talking about ADHD in females and older adults.
Yeah, so Lexi, we'll just get started with you. Can you tell us a little bit more about your topic?
Yeah, so with ADHD, it's generally thought to be a very male-dominated disorder. When you think of ADHD, your mind almost immediately goes to younger boys and then just like teenagers with ADHD, but it's not really talked about with females and older adults. It's just really thought of a developmental boys type of disorder. And so I wanted to do research looking at females because as we've learned more through this course, it is not dominated by males. It is actually like 50-50, but the females are just underdiagnosed.
Yeah, so can you tell us a little bit more about the female perspective on it?
So with females with ADHD, they generally have an inattentive subtype of ADHD. So there's 3 different subtypes that you can have. You can have inattentive, hyperactive, and then a combined. Hyperactive is generally what most people think of when they think of ADHD. That's just when you are like not being able to sit still and you're constantly being disruptive. You're super fidgety. You interrupt a lot. You can't really wait to take a turn, and you're just like constantly on the go. Those are generally very outwardly expressed, and so that's what people think when they have ADHD. With inattentive, which is what females generally have, it's more in your head, so you'll have difficulty like maintaining attention, or you're constantly daydreaming and you get distracted easily. Things that you don't really notice super outwardly, it's more so just internalized, which is why it's like really hard to diagnose females half the time.
What have we done to change our diagnosing process then?
There hasn't been much to change the diagnosis. There have been questions raised with the diagnostic material. They believe that it's more, I guess, what's the word I'm looking for? It's like better for males to receive a diagnosis. Like the diagnostic criteria is more focused towards diagnosing males than females. So they've raised the question on whether you should have a separate diagnosis for each of the sexes because it does present differently in both of the sexes.
Did your research focus on a lot on why girls are not getting the same attention?
I tried to find research with it. The research revolving around females with ADHD is still very limited right now. They're trying to conduct more research, but it's hard. They did have a few reasons that there might be these sex differences. One of them was differences in gray and white matter development, hormonal differences, especially with the onset of puberty and with the timing of the onset of puberty was a big thing. Also that women mature a lot quicker than men do, and also the social norms surrounding women and men. It's more acceptable for men to have this diagnosis, and women are not supposed to, and there's just social stigma around it. But they are trying to use more inclusive language and do more research revolving females with ADHD so that they can understand more why they present differently and how it is affecting them.
Yeah, so since females are less likely to have outward expressions, does it make it harder to give them diagnoses since a lot of the symptoms are more internal?
Yes, it does, because most of the diagnoses come from recommendations from parents and teachers. So a teacher will notice when a student won't be able to sit still, and then they refer them to go see a psychologist or a psychiatrist to go try and get a formal diagnosis. But when you can't physically see those symptoms, they're never referred, and so then they have a harder time receiving those diagnoses.
Is it that the symptoms are indetectable, or just that we haven't like societally been told that these are now symptoms of ADHD? Like, could we inform people better so that we just know the difference between the inattentive and hyperactive?
It's a little bit of both. Most people don't look for the inattentive symptoms, and even when they are noticed, they are played off as something else. So like, oh, you're just anxious, or oh, you're just being forgetful. Oh, you're just living in your head a little bit more. You're just off in your own world. You just don't like to pay attention, but they don't really see the seriousness of it.
I see.
Yeah. It's very sad to an extent, but they're trying. And yeah, it's mostly just trying to break those stereotypes.
That sounds great.
Yeah, sounds good. Well, would somebody else like to talk about their topic then for a little bit, or?
Yeah.
Yeah.
We can transition over to my topic about attachment theory related to PTSD. I'm going to start with attachment theory, which was created sometime between the 1950s and 60s by John Bowlby. And this theory involves a 3-tier scale of attachment, which ranges from anxious to secure to avoidant. And the initial intended use of this theory was to gauge the level of security between offspring and their primary caregivers.
Could you describe what each type of attachment involves?
Of course I can. So one's attachment style is generally pretty unwillingly predetermined, as it begins between children and their caregivers. So growing up, when one is presented with internal and external stressors, we have coping strategies, which are either conscious thoughts and behaviors or unconscious, which we use in an attempt to combat, control, or manage an uncomfortable situation. So if we have a child who receives love and support in early relationships, they will develop an internal dynamic model, or IDM, which deems themselves worthy to give and receive love or care of that same caliber. Or we have a child who experienced unpredictable environments and maltreatment who may develop an IDM, feeling undeserving of love, so unstable behaviors from them are to be expected.
So what's the difference between being anxious and being avoidant?
Anxious attachment is typically going to stem from a fear of abandonment and constant desire or need for reassurance. An avoidant attachment is going to come from a fear of intimacy instead, and a preference or drive for independence. So the two are not compatible.
Is it possible to have a combined of those two?
Without a doubt. Many people shift between the 3 scales more than they know, depending on what situation you're encountering. It can really jump between, like, whether you're in a platonic relationship or a romantic relationship, and how you handled those early in life, how conflicts were presented to you as a kid. Like, that will all go into how you then present yourself and handle your own situations coming into adulthood.
Yeah, so it sounds like a lot of your work has to do with looking into childhood experiences. Is there anything that you notice that was based on post childhood or going into adulthood?
Definitely. So we can see, if you look at an adult with avoidant tendencies, you can predict with attachment theory that there could have been unstable household and or childhood dynamics. And relating it back to PTSD, we can understand the factors which causes someone to become caught in a cycle of abuse and or going back to that cycle of abuse, which then creates our PTSD within that.
Yeah, super interesting.
With your PTSD portion of your research, is there a certain type of attachment style that people with PTSD tend to
lean towards after? I would say most of my research catered towards avoidant attachment with the PTSD, whether that's direct exposure for the majority of what we're talking about instead of just witnessing something else. They tend to have lots of nightmares and flashbacks, along with just emotional distress, and people typically like to distance themselves from that, whether that just be gaslighting yourself into thinking it wasn't real, because more than likely people coming out of these situations have some experience with gaslighting. And yeah, they're just going to try and push away from it. I would say the anxious attachment comes into the next relationship, whether that be a healthy or an unhealthy one, but you're going to be constantly, if somebody has gone through all of the motions, like there's going to be second guessing happening, and there's going to be over analyzation of habits and what is the word? Behaviors, yeah, between the new partner that did or didn't occur with the old one.
So with all of your research, do you think it's possible after you get into a more healthy relationship after a toxic one, do you think you can move from a avoidant and anxious attachment style to a more secure one?
I do. From personal experiences and from my research, I think it's possible. It takes work and it takes therapy, whether that be counseling, group therapies, EMDR. Like there's lots of treatments that are around for people to submerge themselves in, but it takes wanting to get better. That is the biggest thing. Like somebody has to not want to be put in that situation again. And unfortunately, in the US, our re-victimization rates of intimate partner violence are close to 47.9%, which is now 3 times higher than the reported sexual victimization rate among women without a history of childhood sexual abuse. So many people who have a history of childhood abuse are more likely to go back to repeating patterns. But outside of that, and even with that as a factor, I do think it's positive. Possible. I think if both of you have compatible communication styles, or you know how to communicate with the other, you know what your own quote-unquote triggers are, you know how to separate yourself from an uncomfortable or an unsafe situation, I absolutely think somebody can make their way from anxious or avoidant to secure. But it takes time and it takes work.
It's interesting. I feel like you don't hear about attachment styles all too often, with actual research at least.
I think they're not spoken about as much. I think one of the best things we can do for ourselves and those around us is to be educated about attachment theory, again, in both romantic and platonic relations, because in better understanding ourselves, we get a larger perspective of the world and those around us in all of the inner workings of our lives. So we have this added interpersonal awareness to access then intrapersonal relationships more easy. We have the tools to recognize when a connection in our lives, potential or current, is beneficial or harmful.
Nice. Well, that was very interesting. Issa, would you like to talk about your subject, or I can talk about it first?
I can go.
Okay.
I picked stress and anxiety in college students because I know it's something a lot of us go through. And I kind of just wanted to raise awareness that it's not just you feeling it, it's your friends, it's your classmates, like everyone around you. And first, I kind of just wanted to talk about what the research was showing me. One of the things that shocked me the most was that it's actually a lot more like arts majors that feel the stress of their major and leads to more like anxiety compared to what you would think to be more typically like demanding majors like engineering, business majors, computer science, stuff like that. And also, it was found that it doesn't necessarily matter like how many credit hours you take. It's just like how demanding you feel your major specifically is, like mentally, like the type of workload you're receiving. So a lot of the research showed that, for example, psychology majors do feel a lot of the stress and anxiety like within their study due to the like nature of what they're studying, and being surrounded by these topics like can take a toll on the students themselves.
Yeah, so what are some things that maybe these majors who do experience like such high levels of stress can do to like minimize that, or maybe not so much minimize it, but like cope or find like good outlets basically to do?
So While I was doing my research, I found that a lot of studies actually showed, like, were looking into that, and it was found that a lot of universities who kind of set up like a, what you would call like a peer support program with more like people who are also in your major but more ahead, like maybe like an incoming freshman being paired up with a senior, like those type of peer support systems were really beneficial for students, as it gave them someone who knows what they're going through and like was able to express their feelings with them.
So Issa, I know you said that you think it's more, or that arts majors are more stressed, probably because of the topics that are surrounding them, but do you think that there's any other reasons why arts majors in comparison to like engineering majors who are constantly doing work and stress and like really struggling with their majors are able to cope with that a little better?
Personally, at least from like, first what I found in the research was that a lot of like, it has to do a lot with what psychology majors are constantly covering. You know, it's like, it's harder to process like all this when you're learning about, for example, like heart disorders and like what goes into those and like why people are experiencing them. It can be a lot to deal with. And also just from personal experience, I know that there's people out there who like picked psychology as their major just because they didn't necessarily know what they wanted to study. And I feel like that can also just lead into a lot of pressure and like anxiety when it comes to assignments, especially if you don't feel like you're super into it and you're just doing it to get by. At least from like experiences I've had from people I know that can definitely play a role into just like how you view school and your academic work and like how you're dealing with that pressure. Like if you don't feel super connected to it, you're less likely to want to do it, and that can create more stress, cause more procrastination, leading to more anxiety. It's just like a constant cycle.
Yeah, so do you think there's like outside career stress maybe possibly? Because I can imagine like if someone is choosing to do psychology or any major as like a matter of fact and like they're not 100% super into it, do you think there's like the possibility they may be worried like outside of college and like going into the workforce that, you know, it might be something they don't enjoy or whatever?
Yeah, I feel like that can definitely be a big stressor, especially with just kind of like job security at the moment. I know that a lot of people in this day and age have been very worried about like job security and like life after college. So I feel like that can definitely be a very big stressor, especially if you're already feeling like you're not necessarily enjoying what you're doing. Trying to find a job opportunity within your major that not only you feel will be able to support you, but will like give you the quality of life in the sense of like happiness that you are searching for. It can be difficult, and that also can create a lot of stress, which in turn will lead back to your schoolwork and how you're handling it.
Did any of your research talk about concerns about quality of life, or do you have anything to say about how we're basing all of what we do on either it being financially supportive or making us happy?
The only thing I really like saw on my research when I was looking at the topic specifically was that, you know, like unfortunately a lot of people have a misconception of like when you go into this major it's like an automatic, you make a lot of money from the go. But as for I can hope most of us are aware of, this takes a lot of schooling, which if you don't necessarily have the funds can lead into a lot of debt. And I feel like that's also a really big stressor for people, especially when you're looking at careers outside. Like you're not going to be making 6 figures automatically or whatever it is that you think you're going to make. You have to do internships. You still have a lot of schooling to do after your first 4 years. You have internships. You have to practice with other professionals and be able to gain experience before you can really take clients on. And I feel like that's something a lot of people overlook, and they think that once your 4 years are over, that's it, and you can go straight into it. So I feel like that's definitely a factor that a lot of people overlook when making their decision.
What would you say is like the best coping strategies to help counteract all of the anxiety and depression?
A lot of my research found that it has to do a lot of with like how as students like using the resources around you, whether maybe your university has counseling services that you can go to, or I know at least our school, CU Boulder, is pretty good at having like tutoring services, like that you make, like the library has good services. You can go for tutoring, seeking out help that way. We have mental health services that can help. And a lot of my research also really emphasized on using your community, like your friends around you, your TAs, and reaching out to people who are close to you to help you. It'll really these are the people that know you the best, and having their support and their guidance will definitely help relieve some of that stress, that anxiety, and will help you do better in your studies and feel that the workload isn't as heavy overall.
Do you have any recommendations for students who may have a harder time asking for help?
My big thing is I know that it seems really scary, and at least the way I do it for myself, I get really anxious when I have to maybe talk to a TA or talk to a professor, but the main thing I tell myself is no one else is gonna do it for you, and would you rather suffer alone or maybe take that chance and be willing to maybe ask for help, and it will turn out positively. And maybe let's say things don't go the way you were hoping, at least you tried, and you're making steps that way. At least you're progressing. It's a step forward nonetheless. Okay.
Yeah, that's a super interesting topic. Does anybody else have any more questions or anything like that?
You said blew all my questions away.
Yeah.
Thanks, Rye.
Well,
I'm gonna hand this over to Tommy.
Yeah, of course. So my research was similar to Lexi's and studying gender and stuff like that, but mine focused more on panic disorder. So for those who don't know what panic disorder is, the DSM criteria classifies it as having a history of panic attacks, as well as having fear of panic attacks. And something that's super interesting about panic disorder is that there's a 2-to-1 female to male ratio of people who experience panic disorder. So my paper and my research really dives into some of the statistics behind that and why there might be these kind of influences basically for why that exists. So one of the first things that I looked at was the National Comorbidity Survey, which actually one of my studies that I looked into covered. So the National Comorbidity Survey found that in 2.5% of the respondents who reported having or experiencing panic disorder were female, and there was only a 1.3% of respondents who were male. And so in the study, I found that out of the 8,098 individuals they interviewed and questioned, 274 met criteria, with 194 or 70.8% being female, and only 80 respondents or 29.2% being male. So this kind of hits around the 2-to-1 ratio mark that we see within the National Comorbidity Survey. And out of the 274 people who met criteria, 33.9% were in the age range of 25 to 34 years old. So these statistics show that, it kind of goes with what we know of females being more likely to have this. So in one of the other studies I looked at, I wanted to see why there might be these disparities and why there's so many more women who experience this. So in the study I found, it said that women are more likely to be affected by chronic stressors such as domestic conflict at home, or experiencing lower salaries and fewer promotion opportunities, or just instances in the workplace that are just not normal and typically seen, as well as the study looked at general gender representation, or how people report their symptoms, and it's found that men typically report less than women. And when they do report, they tend to underreport their symptoms. So this could be one of the reasons that we see there's such a high, there's so many more women who meet criteria for panic disorder because men just aren't reporting as many symptoms that they have. And this, if we think about it from like an evolutionary perspective, like men are typically, we're seen as like protectors and people who weren't supposed to show as much emotion. And so this kind of carries over time and is still represented today. We can also look at like genetic influences and stuff like that. So people who have relatives who have panic disorder are 3 times as likely to also have panic disorder. And there are genetic associations with women that make them more likely to have panic disorder. And if we continue along the genetic perspective, we look at specific things like serotonin transporter or 5-HTT, which is shown to be more prevalent in people who have panic disorder. Another study that I found, they found that it's typically more elevated in men than it is in women, which is super interesting because it would make it seem like men are experiencing like more severe symptoms, but it doesn't correlate with what we see in how they're underreporting and stuff like that. So one of the reasons that we think that this might be is because if women are more likely to report their symptoms, they're also more likely to receive treatments such as SSRIs. And SSRIs would influence the amount of 5-HTT we see in them. So if they're taking it, it's less likely to bind to the serotonin. And if men aren't taking it, they're going to have obviously higher levels than women. Some other things that I looked at concerning panic disorder were the comorbidities between them, because within these disorders, we see that there is still a high prevalence of other disorders that are paired with them. So one of the most common ones that we see is major depressive disorder, which is unfortunately a super common disorder and is especially prevalent in women. When I looked at some of the research, I found that 10% of people with major depressive disorder have panic disorder. And while that percentage may seem small, since major depressive disorder is such a common and vast disorder, it actually does influence the rates that we see of panic disorder. And then some other comorbidities that are there, but I didn't feel were as prevalent in influencing the numbers, were that there's a 21% of like comorbidity of people who have bipolar disorder who also have panic disorder. Continuing with that, I think some things that we need to research more are the emotional expression in non-Western cultures. We know a lot about what expressions and like emotions we feel are common in Western cultures, but it's not really studied as much in other cultures who may not show the same emotions we do in the same context. So I know that was a lot. Did any of you guys have any questions or anything like that you wanted me to talk about?
Yeah, I know it's what you said you needed more research on, but I'm curious to know your perspective on Eastern versus Western cultures regarding emotionality, because yes, I think there's less research in the Eastern world, but I wouldn't necessarily say we've come to terms with it in a drastically better sense, because clearly men still feel like they can't report their symptoms when they're struggling, and we're lacking in resources on that end of things. And yeah, I'm just curious on your thoughts on that.
Yeah, that is super interesting, and like definitely one of the things that I wanted to look at more when writing my paper. I think just based off my personal opinion, I think men are, especially in Western cultures, even though it's not really shown in the research, men in Western cultures, I think, are actually more expressive than in like more Eastern cultures that we don't see. So I think one of the things is just something I've like heard about, but I know from like friends' experiences, like in like Europe, for example, smiling is not as common as in the U.S. And so we see more visible like emotional expression in Western cultures, I think, than we do in Eastern cultures. And along with that, I'd assume that there's also probably less likely of a chance that men in Eastern cultures will report those symptoms because it may come off as more normal to them in their cultures. And I think it's definitely one of the reasons why we need more research on the topic, because since there's less of a visible expression, sometimes you have to resort to more self-reporting methods, which, can be unreliable at times and extremely biased. So I think looking for new ways to measure emotional expression in Eastern cultures is definitely something we need to look into.
Definitely, that's super interesting.
Yeah.
So I was going to ask you, do you think that the more that men show and express their emotions, the more that they're going to get diagnosed? Or do you think that the more they express their emotions, it's going to be easier for them to like cope with it and they won't actually have the disorder?
Yeah, I think actually both kind of would happen. If you have people who are expressing their symptoms and, not underreporting, you are going to have a spike in people who are diagnosed or meet criteria for panic disorder. And I think, also letting people know that it is okay to feel these emotions and speak up about it, and especially talk about it like with a doctor and a medical professional. It is a good way of coping, and you have people who now know that there might be a reason that they're feeling this way and like they're experiencing these symptoms. And obviously, if you're talking to a medical professional about it, you can receive the proper treatment that you need to kind of deal with this and cope. So.
How do you feel like would be a good way to raise more awareness so that men feel like they can really like speak up about it and get the help that they need?
Yeah, so from at least just like my experience as a man, I think one of the most important things and things that I've seen already is like things like people bring up men's like mental health awareness month and, encouraging men to speak up about their like emotions and that sort of stuff. And I think there's a huge stigma about how men aren't supposed to be expressive and, not supposed to feel emotional in these senses. It's something that is more harmful, I think, than they realize. And it does a lot more bad than it does good. So just making sure, you tell your loved ones that it's okay to speak up about any issues that they have, or, making sure that you're there to support someone when they need is a super beneficial way of making sure that men do speak up about issues like that. So, yeah. Any other questions you guys had?
I think that covered all of my questions.
Yeah, so that's going to be the end of our segment. I hope you all enjoyed listening and learning about our topics. And yeah. Hi, my name is Thomas, and I'm going to be talking about panic disorder and the prevalence between men and women.